Dear doctors, welcome to a demonstration of how you can perform the second trimester risk assessment using EMRald. As you would know, the nuchal translucency scan or the NT scan, including the assessment of risks for trisomy 21, 18, and 13, is a very critical or a milestone scan or screening done during pregnancy. This scan is best done between weeks 11 and 14 of a pregnancy. However, if a patient misses this time window and lands up at the obstetrician or radiologist only in the second trimester, can we still do a trisomy risk assessment? Yes, the answer is yes, it's still possible to do that. And there are two steps to it. First is looking up the a priori risk chart, which is based on maternal age and gestational age. And the second one is computing likelihood ratios using various soft markers, which are basically fetal anomalies such as ventriculomegaly or short femur, and so on. The scientific work behind this, the research behind this, has been done by Dr. Snyders and Nicolates on one hand, and Dr. Agathokleos and Sheviva on the other. EMRald automates the entire risk computation in an elegant manner, as you will see in the demo, which I will show you right away. So here I'm preparing a report for a patient in her second trimester of pregnancy. As you can see, the gestational age is 17 weeks, and this is the second trimester anomaly scan that I have opened in EMRald. It's currently all default, so everything is normal. And basically, what you will see is that in the report there are various sections, and one of them is the second trimester risk assessment, trisomy risk assessment. Currently, it is blank because by default we leave it off. It is not done. However, in cases where it is necessary, please go to the trisomy risk assessment paragraph here and select that you want to do the scan. And when you do that, you will see that there will be additional data appearing here, additional text appearing here, and tables which are about the second trimester risk assessment. So how do we how do we run the automation and perform the risk assessment? Simple as always. Click on the red star at the top, and there you will see a number of fields that need to be filled. That includes the fetal heart rate, the gestational age, the fetal biometry, and so on. But if you come further down, what you will see is that there are variables related to the trisomy risk assessment. So the ones in red are the ones of interest for us. This is the echogenic intracardiac focus. Is it present or not? Is it seen or not? So we say it's not there, for example. So I'll start with an all normals case. Hydronephrosis is not seen. Short femur, no, it is a regular femur. So we say it's not seen. Echogenic bowel is also not seen. Increased nuchal fold, no. ARSA, no. Nasal bone status is normal in size, and ventriculomegaly is absent. So everything is fine in this patient, everything is normal, and then we run the calculator. So to do that, you go click on this calculator icon on the top left, and when you click that, you will see multiple calculators. One of them is second trimester risk assessment, and there we click on this auto button. When I click on that button, you will see that the calculation has started, and it's in fact complete already. And what you see here are the results that the calculator has returned. So the a priori risk is quite low essentially, and adjusted risk, meaning given that there are no fetal abnormalities, the soft markers are all indicating that everything is fine, then the adjusted risk is even more low, which means everything is fine with this patient. And you will see that in the impression as well, no sonologically detectable anomalies, and everything is fine. However, if there were any abnormalities, what would happen? So let's take a look at that. We go back to these to the form and we change some of these things. For example, we say echogenic bowel is present, and let's say ventriculomegaly is also present. So if these two soft markers were positive, if these two conditions exist in the fetus, then what happens? Let's run the calculator again, and we will see the results. Go back to the calculator, click on auto. The calculator is running, and you will see the results now. The results, in fact, are are quite dramatic. The adjusted risk, if you see, is quite high for all the three trisomies, in fact. And you will see that uh, the increased risk of trisomy 21 and 18 is marked out, is called out, and it's shown in the impressions. For trisomy 13, the risk is significant. It is 1 is to 188. However, we are using a risk cutoff of 1 is to 150, which is the standard recommended by the Indian Radiology and Imaging Association, because of which trisomy 13 is not flagged as a risk. However, trisomy 21 and 18 are flagged as risks, given that the risk factors is higher than 1 in 150 for these two conditions. So this way, you can very easily compute the risk given various fetal abnormalities that are the soft markers for this case, and given the maternal age and the gestational age. As you saw, none of this information had to be entered anywhere. The whole thing is very simply automated. You just fill in the soft markers. You would have already filled in the maternal age when the report creation started. In fact, from the billing onwards, the maternal age would be known. The LMP information is known, because of which the gestational age is known. All this information is used, and it is used for computing the risks, as you saw, and the risks are added in the report, and corresponding impressions also appear in the report. Thank you for watching this video. You can get more information about the company and our products on our website www.emrx.in, and you can also get more videos on our YouTube channel, which is bit.ly/emrx videos. Thank you again.